VQA, MedRAX utilizes models like Chexigent, which, as we mentioned earlier, is specifically designed for chest X-ray interpretation. It's trained on a massive data set of chest X-rays, and it's really good at understanding those visual nuances that are so important in this context. MedRAX also incorporates LiveAMed, that powerful biomedical visual language model we talked about, the one that's really good at zero-shot learning. So, by combining these different approaches, MedRAX can answer open-ended questions about the CXR, drawing both on what it sees in the image and its broad medical knowledge.
That's amazing. And then there's the task of actually identifying and outlining specific structures within the image, the segmentation part. What models does MedRAX use for that?
For segmentation, there's MedSam. That's a super advanced biomedical segmentation model. It's been trained on a huge data set of medical images, not just CXRs, but images from various different types of scans. It can segment all sorts of anatomical structures and abnormalities across a range of diseases. And then there's PSPNet, which is more specialized for chest X-rays. It's trained on a data set specifically annotated with common chest diseases and abnormalities.
So MedSam is like the generalist and PSPNet is the chest specialist. I like it. Our notes also mention grounding. What does that refer to in this context?
Grounding is the ability to link specific words or phrases in a text description, like a radiology report, to the corresponding regions in the image. So if a report says something like there's an area of consolidation in the lower left lobe, a grounding model can highlight exactly where that is on the X-ray. And for this, MedRAX utilizes MAR2, which is a large vision language model that excels at grounding text descriptions in medical images.
Okay, so it's bridging the gap between language and visuals. That's really cool. And what about the task of actually generating those detailed radiology reports?
For report generation, MedRAX employs a powerful combination of a SwinV2 transformer model with a BERT decoder. This model is trained on a massive data set of expert-written radiology reports, and it can generate really comprehensive summaries of the findings in the CXR.
Wow, so it's learning to write reports just like a human radiologist. And then, of course, there's the core task of identifying and classifying diseases and abnormalities, right?
Exactly. And for that, MedRAX uses a DenseNet 121 model. This is a very well-established model in the field, and it's trained on multiple large chest X-ray data sets. It can accurately predict the presence of various conditions like pneumonia, collapsed lung, fluid buildup, nodules, and more.
So